Today I am talking about horizontal jaw relation. Horizontal jaw relation, it is the relationship of the mandible to the maxilla in a horizontal plane. It can also be described as the relationship of the mandible to the maxilla in anterior-posterior and side-to-side direction. Types of horizontal jaw relation. Number one, centric jaw relation. Number two, eccentric jaw relation, which can be classified into protrusive relation and left or right lateral relation. Centric jaw relation. It is the maxillomandibular relationship in which both condyles' head articulate with the thinnest avascular portion of their respective disc, with its complex in the anterior superior position against the shapes of the articular eminence. Centric occlusion. It is the contact between the occlusal surface of the maxillary teeth with the opposing mandibular teeth, when the mandible in centric relation. Maximal intercuspal position. The most complete interdigitation of the teeth independent of condylar position. Maximal intercuspation is a maxillomandibular relationship determined by tooth-to-tooth relationship. Importance of centric jaw relation. It is a reference position from which the mandible can move to any direction. Number two, it is a learnable, repeatable, and recordable position. Number three, it is the start point for developing occlusion. Number four, functional movement like chewing and swallowing are performed in this position. Number five, it is a reliable jaw relation because it is bone-to-bone relation. Methods of recording centric jaw relation. Number one, functional chew-in method. Number two, graphic method. Number three, tactile or interocclusal check record method. Functional method. In this method, we have different techniques. A. Needles house technique. This method used impression compound occlusion rims with four metal styli placed in the maxillary rim. When the patient moves his mandible, the styli on the maxillary rim will create a marking on the mandibular rim. After movements of mandibular completely, a diamond-shaped pattern is formed. The anterior-most point of this diamond pattern indicates the centric jaw relation. B. Patterson technique. In this method, a trench made along the length of occluding part of the mandibular wax rim. A mixture of pomace and dental plaster with a ratio 1:1 is loaded into the trench. When the patient moves his mandible, compensating curves on the mixture was formed due to decreased height of the mixture. The patient asked to continue with this movement until a predetermined vertical dimension obtained. Finally, the patient asked to retrude his jaw and the occlusal rim fixed with metal staples. Swallowing technique. In this method, soft cones of wax are placed on the lower record base. The wax cones contact the upper occlusion rim when the patient swallows. This method is also used to record occlusal vertical dimension. Graphic method. In this method, use the graphs or tracing to record the centric relation. The general concept of this technique is that a pen-like pointer attached to one occlusal rim, and a recording plate is placed on the other rim. The plate coated with carbon or wax on which the needle point can make the tracing. When the mandible moves in horizontal plane, the pointer draws characteristic patterns on the recording plate. The graphic methods are either intraoral or extraoral. The characteristics patterns created on the recording plate is called arrow point tracing, also known as Gothic arch tracing. The apex of the arrow point tracing gives the centric relation with the two sides of the tracing originating at that point being the limits of the lateral movement. The apex of the arrowhead should be sharp, else the tracing is incorrect. The extraoral is preferable to the intraoral tracing because the extraoral is more accurate, more visible, and larger in comparing with the intraoral tracing. The last method used for record the centric jaw relation is tactile or interocclusal cheek record method. According to this method, the centric relation is recorded by inserting a recording medium between the maxilla and mandible occlusal rims when the jaw is positioned at centric relation. This method is simple because mechanical devices are not used in the patient mouth and occlusal rims. An indication of interocclusal cheek record method: abnormally related jaws, displaceable or flabby tissue, large tongue, uncontrollable mandibular movements. It used for patients already wearing a complete denture. Methods used for assisting patient to retrude the mandible. Instruct the patient to let his jaw relax, pull it back, and close slowly on his back teeth. Instruct the patient to contact with his tongue a piece of wax placed on the posterior palatal seal area and slowly close. The patient asked to bring his upper jaw forward while occluding on the posterior teeth. The head tilted backward, which makes protrusion more difficult. The patient asked to swallow and close slowly. Instruct the patient to do routine jaw exercises. Factors that complicate centric relation record. Number one, resiliency of the tissue supporting the denture base. Number two, the stability and retention of the record base. Number three, the TMJ and its neuromuscular mechanism. Number four, amount of pressure applied in making the record. Number five, technique employed in making the record. Number six, the ability of the dentist. Eccentric jaw relation. Any relationship between the jaws other than centric relation, which classified into lateral jaw relation. The relation of the mandible to maxilla when the lower jaw is in opposition to either side of centric relation. Protrusive jaw relation, the relation of mandible to the maxilla when the mandible thrusts forward. Methods of recording eccentric jaw relations. The methods are similar to that used for recording centric jaw relation, which include the functional, graphic, and interocclusal records. Interocclusal record for eccentric records, which include protrusive left and right lateral movement, can be made on the occlusion rim or on the posterior teeth at the try-in appointment by Hano articulator, which is used to register eccentric record according to the following formula. Factors considered during making eccentric jaw relation. Number one, the condylar path of the patient cannot be altered. Number two, the condyles do not travel in straight lines during eccentric mandibular jaw movements. Number three, semi-adjustable articulators, in which the condyles travel on a flat path, cannot be used to reproduce eccentric movements exactly. Finally, fully adjustable articulators, where the condylar and incisal guidance is fabricated individually with acrylic, can travel in the path of the condyle using pantographic tracings.